hippocampal formation, which aspect we see? What is this? This is a which lobe? Occipital lobe. Posterior horn of lateral ventricle is visible here, yes? So this one is a hippocampal formation, hippocampus. What is the hippocampus here? The pass of the hippocampus, or a foot, but the pass is the correctly with the digits here, you see? 1, 2, 3 digits, but we marked only the foot, the pass of the hippocampus. And here, if you look, this one is a calcarine, calcar avis. So this means this fissure here, what is visible here, is continuous, yes, and its name calcarine fissure. So I show you this fissure here, is continued from the calcar avis. And this one, here you have the foot, the pass of the hippocampus. This one is what of the hippocamp? Body of the hippocampus, or the here the body forms the fornix. Yes, so here you find the fornix of the hippocampus, and this one is a fornix. Here, you see, all of this goes here and forms the superior aspect of the fornix here, and this one here, what I marked you, maybe here or here. What I marked now, the fimbria, yes. So this is a fimbria of the hippocampus, yes. And what we see, the first one, this one is which dentate gyrus, exactly, yes. So the dentate gyrus, the hippocampus, the fornix, and fimbria of the hippocampus. And here the dentate gyrus, and this must be the parahippocampal. You know about this because we discussed through using this specimen. And this must be the which sulcus? Collateral sulcus. Exactly. Yes? Calcarine, collateral sulcus. Okay. Perfect. And the next one, which specimen is visible here? We look, it's not lateral. Visible too much. Yes, so lateral. So this one I show you is visible. So now what is a direct correctly? This is the anterior, this is a posterior. How to recognize? Caudate. From this one. Yes, you see the head of the caudate nucleus. So the gray substance inside the white one, head of caudate nucleus, and exactly here you see how to the head is continued by a body of the caudate nucleus. So all of what goes here forms in the body of the caudate nucleus. Here is a position of the tail. Yes, it's like the C-shaped position of the caudate nucleus. This one is visible what? Short gyrus. This one like this, short gyrus of insula, and this one is a long gyrus of insula. Yes, it's for your list. But I think if we have a problem of the directions of the brain, enough for me during your practical test if you recognize this like the gyrus of insula. Okay, it doesn't matter if it's a short or long. For me it's very important. Now you know we are from the level of the insula. Okay,
how can we see like which one is short
from
and long?
The anterior goes short, and the posteriorly here originate from the anterior direct to posterior is a long one. So long and the short gyruses. And here is visible, some is visible here. It's a white substance, so which extreme capsule, external capsule, between both capsules you have a position of the gray substance, so it's a claustrum. From this level you do not find, or maybe find only the small pieces of which nucleus lentiform, because it's a so highest section, so it's not visible. Yes, deeply where we goes downwards is visible, like here. So when I use this specimen, I show you and what is possible to mark. Here you see is a caudate nucleus. Yes, head of the caudate nucleus, short gyrus of insula, long gyrus of insula, extreme capsule, external claustrum, and now is the lentiform nucleus. So I think where we have a specimen where is visible lentiform nucleus, then the separate by a claustrum, the putamen, sorry, and the globus pallidus. If you recognize these two compartments of the lentiform nucleus like a lentiform nucleus, will give you points. Okay, so the lentiform is a base. So I think always where you recognize these two structures and name lentiform, nucleus, we give you points. And here is visible
Internal capsule.
the V-shaped internal capsule, anterior limb of internal capsule, genu, and the posterior. What is visible here?
Thalamus.
Thalamus, exactly, yes. The thalamus. So here is visible when I mark like this, but I do not mark you because it's not easy to recognize. It's an anterior tubercle of thalamus. The thalamus compartments I marked using this specimen. Okay, here is visible thalamus. So how to mark to you the thalamus and the structure? Here is visible, you see? The same what I marked here. What is this? Anterior tubercle of thalamus. Here is a pulivar, yes, of the thalamus, this one. Here. And here, above this one, you find, what is this? All of this what is visible here, you see? It's a lamina affixa. Okay, and the lamina affixa is more medially, more laterally. You see here, we have superior thalamostriate vein. Exactly. So here is a superior thalamostriate vein. I think this is possible to mark during the competition. Why not? Yes, this vein. So the vein is the different called from a surname. You know, you remember which vein? Superior thalamostriate vein. Here we have a Gallens Rosenthal veins. Maybe you heard about the Rosenthal veins or not? No? Okay, so this one and more. So here you see the habenular triangle. You see? So we have the two paired nucleus, superior inferior habenular nucleus. Is sometimes visible. This one is visible here. You see? The nucleus, habenular nucleus, but all what I marked here is a habenular triangle. But if you are from a competition, golden scapula, and marked you during the golden scapula, this aspect is not habenular triangle, it's a nucleus of habenular triangle, okay? And here normally we have a position of what? This one, pineal gland. Here is not visible, but you remember I show you the pineal gland from this specimen. Where is visible? This one, yes? Here you have a pineal gland, this. So here normally is a position of pineal gland. And more superior and inferior collicus, of course. How to mark the third ventricle is a question. So I marked you like this, yes? All this pneumatic space is the third ventricle. How to mark the aqueduct, cerebral aqueduct from this section is possible. I marked you like this. But how marked to this section? Yes. So like this, look. When I put like this, pins, maybe it's not visible, maybe from this one aspect. Like this, yes? So you see here is visible the pins and this one, so join the fourth ventricle with a third. Must be the aqueduct. Okay, this one, what is this? Middle one. Peduncle. Yes, this is a middle peduncle.
Bardzo mnie tu się pyta, czy
To?
z nowym mózgowym.
Znowu? Tak. Proszę.
Thank you.
No, you have a floor of fourth ventricle. So this means the same like a rhomboid fossa. Yes? So this is a fourth ventricle. This is a floor of fourth ventricle. Rhomb is like the rhomb shaped, you see? Rhomboid fossa. Here we have a very important nucleus and the eminence. But of course you do not have for your list, so we do not mark. But it's possible to mark the one direct of the what? Of the outflow of cerebrospinal fluid. What I mark now? The central canal. Yes. So I mark like this. Central canal is for your list. Okay? You have a question from